not borders of the heart. Simply these are borders of the anterior surface or the sternocostal surface. A right border is formed by the right atrium and the right ventricle, and inferior part is formed by the right ventricle. So it is formed by right atrium and right ventricle. The inferior surface is inferior border. This is right border, this is inferior border. It is formed by the right ventricle, and part is formed by the left ventricle. This is known as sharp border or acute border. Left border is formed by the left ventricle, and this is known as obtuse border. And the superior border, which is formed by the right atrium and the part of left atrium. The great vessels are leaving the heart from this superior border, like the aorta and the pulmonary trunk. First of all, I will explain the right atrium of the heart. One very peculiar feature of the right ventricle, it is having the thinnest wall in the all four chambers. So right atrium is having thinnest walls in the all four chambers. So right atrium is having, I am talking about the internal structure of the right ventricle. This is the right atrium, and here is the superior and the inferior vena cava. I have opened this right atrium from here like this. This flap of right atrium is removed like this. So this is the anterior surface and this is the posterior surface of the right atrium. A right atrium is having two surfaces, the anterior surface and the posterior surface. The anterior surface is rough surface. This is the rough and having transverse ridges formed by the musculi pectinati. So these transverse ridges are known as musculi pectinati, and this transverse ridge, besides these transverse ridges, there is a vertical ridge. This vertical ridge is known as the crista terminalis. This is known as the crista terminalis. And the external elevation formed by this, or this is vertical ridge, and external sulcus which is formed by this crista terminalis is known as the sulcus terminalis on the outer surface of the right atrium, and it extends from the opening of the superior vena cava to the opening of the inferior vena cava. So this is the opening of superior vena cava, and here is the opening of the inferior vena cava. So in the internal surface of the heart, there is the crista terminalis and the sulcus, which is formed by this ridge on the outer surface of the heart, is known as the sulcus terminalis. The SA node, that is sinoatrial node, which is the controller of the cardiac rhythms or cardiac cycles, is lying in the upper part of this crista terminalis. So anterior part is the rough part, and it is formed by the transverse ridges known as musculi pectinati. This part develops from the embryonic sinus venosus. This rough part is known as the sinus venosus, developed from the sinus venosus, and this part, which is smooth, developed from the primitive right part of the primitive atrium. So this anterior surface is rough and this posterior surface is a smooth surface, and it is having a fossa known as the fossa ovalis. In the embryonic life, or I can say in the embryonic circulation, it is having an opening in its upper part known as foramen ovalis or foramen oval. And it develops from the embryonic septum primum, and here is the annular ring, which is formed by the septum secundum. So during embryonic life, this inferior vena cava is guarded by a wall known as Eustachian wall. There is a wall known as Eustachian wall, and this wall guide the blood which is coming from the mother towards the foramen oval, and this blood, which is oxygenated blood during fetal life, is entering from the right atrium to the left atrium from this foramen oval. So Eustachian wall is present in adult life, but it is non-functional. The inferior part of the fossa ovalis is having an opening of the coronary sinus. This is the major venous channel of the heart. So the posterior smooth part is having opening of the superior vena cava, the inferior vena cava, the coronary sinus, and it is having the remnant of the obliterated foramen oval known as fossa ovalis. So right atrium is having opening of superior vena cava, the inferior vena cava, the coronary sinus, and it is also having the opening of the anterior cardiac veins, small openings. ACV, anterior cardiac veins, are vena cordi minimi, or Thibetian veins, vena cordi minimi or Thibetian veins. Coronary sinus opening is also guarded by a wall known as Thibetian wall. The Eustachian and Thibetian wall are the remnant of the embryonic venous walls. The right ventricle is triangular in shape. In its internal surface, it is triangular in appearance, and it is having the rough part, which is formed by the muscles, or the muscular grid or muscular mesh is formed by three types of muscles in right and left ventricle. These are known as the tendini cordi. These are known as trabeculi carni. There are three types of fibers in the trabeculi carni: the rhizes, the bridges, and the papillary muscles. So it is having three types of fibers: rhizes, bridges, and the papillary muscles. The rhizes are the transverse rhizes and some vertical rhizes covering the internal surface of the ventricle. The bridges, which are running from the interventricular septum to the middle of the lumen. The middle part of these bridges are free, but in case of moderate band, this is the moderate band, and this is connecting the interventricular septum to the anterior cusp of the tricuspid wall, and it is housing the right branch of the bundle branch or bundle of His. So this is the moderate band. The cusp, this is the semilunar or the pulmonary wall, and here is the tricuspid wall, which is having the anterior, the posterior, and the septal cusp. This is known as tricuspid orifice or tricuspid wall or right atrioventricular wall, and it is having three leaf-like cusp: the anterior, the posterior, and the septal. Now, the small triangular muscles. Apex toward the tricuspid wall, and these are known as the papillary muscles. Papillary muscles. And the fibers connecting the papillary muscle apex and the cusp of the tricuspid wall is known as chorda tendini. This is known as chorda tendini. This is regulating the opening and closing of the tricuspid wall. So right ventricle is having the three sets of the papillary muscles, the anterior, the posterior and the septal, and these are regulating the opening and closing of the tricuspid wall by the chorda tendini. This is the chorda tendini. The trabeculae carni of the left ventricle is very fine in comparison to the right ventricle, and there are only two sets of the papillary muscles, the anterior and the posterior, because the left atrioventricular orifice is having only two cusps. So one is attached to the anterior and other is to the posterior, and this is the opening of the left. This is the left atrioventricular opening having bicuspid or mitral wall, and this is the wall of the aorta, that is semilunar wall having three cusps. The walls of the left ventricle are 3 times thicker than the walls of the